Fibrinolytic drugs. Introduction. Fibrinolytic drugs initiate the fibrinolytic pathway. These agents include recombinant TPA and its variants, urokinase and streptokinase, although the latter are rarely used. Fibrinolytic pathway. Plasmin is an endogenous fibrinolytic enzyme that degrades clots by splitting fibrin into fragments. The thrombolytic enzymes catalyze the conversion of the inactive precursor, plasminogen, to plasmin. Tissue plasminogen activation. TPA is an enzyme that directly converts plasminogen to plasmin. It has little activity unless it is bound to fibrin, which, in theory, should make it selective for the plasminogen that has already bound to fibrin, i.e., in a clot, and should result in less danger of widespread production of plasmin and spontaneous bleeding. In fact, TPA's selectivity appears to be quite limited. Alteplase is normal human plasminogen activator. Reteplase is a mutated form of human TPA with similar effects but a slightly faster onset of action and longer duration of action. Tenecteplase is another mutated form of TPA with a longer half-life. Streptokinase. Streptokinase is obtained from bacterial cultures. Although not itself an enzyme, streptokinase forms a complex with endogenous plasminogen. The plasminogen in this complex undergoes a conformational change that allows it to rapidly convert free plasminogen into plasmin. Unlike the forms of TPA, streptokinase does not show selectivity for fibrin-bound plasminogen. Clinical use. The major application of the thrombolytic agents is as an alternative to percutaneous coronary angioplasty in the emergency treatment of coronary artery thrombosis. Under ideal conditions, i.e., treatment within 6H, these agents can promptly recanalize the occluded coronary vessel. Very prompt use, i.e., within 3H of the first symptoms, of TPA in patients with ischemic stroke is associated with a significantly better clinical outcome. Cerebral hemorrhage must be positively ruled out before such use. The thrombolytic agents are also used in cases of severe pulmonary embolism. Toxicity. Bleeding is the most important hazard and has about the same frequency with all the thrombolytic drugs. Cerebral hemorrhage is the most serious manifestation. Streptokinase, a bacterial protein, can evoke the production of antibodies that cause it to lose its effectiveness or induce severe allergic reactions on subsequent therapy. Patients who have had streptococcal infections may have preformed antibodies to the drug. Because they are human proteins, the recombinant forms of TPA are not subject to this problem. However, they are much more expensive than streptokinase and not much more effective. Thank you for watching. Please do subscribe.